You are about to enter the courtroom of Judge Oncology. The people are real, the cases are fake, and the rulings are subjective. I'm a Notwell, a cancer patient, is suing Mr. Breast Cancer, a cancer cell, for medical bills related to chemotherapy and pain and suffering. Mr. Breast Cancer claims, "What are you talking about?"
All rise for the Honorable Judge Oncology. Parties have been sworn in. You may be seated.
Calling the case of Iowa Notwell versus Mr. Breast Cancer. Are both sides ready?
Ready, Your Honor.
Ready, Your Honor.
Mrs. Patient Advocate, you may begin with your opening statement.
Your Honor, my patient has suffered countless damages on the account of the defendant, Mr. Breast Cancer.
Mrs. Notwell, what damages have you suffered on account of Mr. Breast Cancer?
Because of Mr. Cancer, I have undergone chemotherapy treatment and I suffer from hair loss, nausea, vomiting, fatigue, infection. Wait 1 second. And these continue to change my life on a daily basis.
So what do you want from Mr. Cancer?
I'm just asking that Mr. Cancer be put on doxorubicin, also called adriamycin, which will reduce the tumor while he's in jail so he doesn't infect anybody else.
I'm not familiar with doxorubicin. Will you please further explain this drug?
My lawyer knows more about it.
Mrs. Advocate, will you please further explain this drug to the court?
Yes, doxorubicin is an anti-tumor, anti-neoplastic drug that has a wide spectrum of cytotoxic activity against solid tumors.
So how does the drug work?
It binds to DNA, splitting and inhibiting the DNA synthesis. It is cell cycle nonspecific.
So can this drug cause any further harm to your patient?
Yes, it can cause adverse effects like nausea, vomiting, mucositis, rash, alopecia, temporary decrease in fertility, myelosuppression like leukopenia, thrombocytopenia, anemia. It can also cause arrhythmias and serious myocardial toxicities.
Is there anything you need to consider if your patient starts taking this drug?
Yes, it can cause urine and your tears to turn a reddish color. This is normal, but it is something you need to be aware of. You can't wear contacts during the duration of your therapy. Don't play with your eyes because it can cause conjunctivitis. You need to have contraceptive measures for at least 4 months following therapy. You need to have good oral hygiene before and after meals. Some lab tests that we will do are renal function and CBC throughout the duration of your therapy. You need to report signs and symptoms of cardiotoxicity, hepatic dysfunction like jaundice and dark urine, kidney dysfunction, so we need to monitor your I's and O's, report signs and symptoms of superinfection, and avoid rectal medications.
Thank you for explaining that, Mrs. Advocate. Now, Mrs. Notwell, even though this drug causes adverse side effects, you're still willing to go through with this treatment?
Yes.
Now, out of sheer curiosity, Mr. Cancer, why did you choose to not have representation today?
No one wanted to represent me.
I wonder why. All right, Mr. Breast Cancer, I'm ready to hear your defense.
Well, I'm really confused why I'm here today because I feel like I'm one of you guys. I'm just doing what I'm told and I'm blindly obeying.
You're not like us. We don't harm other people. Now, who told you to replicate uncontrollably?
I'm not sure.
Okay, let me see if I'm understanding this correctly. Previously, before replicating uncontrollably, you replicated on a normal schedule with no complaints from your client and everything was fine, and then someone who you're not sure who they are told you to replicate uncontrollably and create a mass, a tumor, and which is causing harm to your patient, and you didn't question whether this was a good idea, you just followed it blindly. Am I understanding you correctly?
Yeah.
Yes. Yeah is not an answer.
Yes.
Okay. Mr. Breast Cancer, I can't help you. You are either very stupid or fooled very easily, probably both, and I have no choice. Judgment for the plaintiff for the cost of all medical bills, for chemotherapy, and for all treatments related to breast cancer. Mr. Cancer, you will also be treated with doxorubicin until you decide to stop replicating. Immediately after his trial, Mr. Breast Cancer escaped custody and is currently wreaking havoc on thousands of women worldwide. Call 1-800-SAVE-A-BREAST if you have any information regarding Mr. Breast Cancer.
I'm glad I don't have a lot of lines in this. Sorry.
No, you're good. I'm just like,
You should add that. You should add that in the blooper.
Yeah, get
Sounded good.
yeah, but I was like,
It's alright. Vomiting.
So we are, yeah, right, okay, never mind. Okay.
okay, give me a minute. Okay, we're good.
Because of Mr. Cancer, I have suffered many problems. Heart loss, heart loss.
Should we start over?
Is there anything you need to okay.
That would be funny out there. Because you did it like twice so that it would.
Hold on, you're in my board.
Camera.
Oh, I'm sorry. I messed her up. I was trying to stay low.
The end.
Stop recording.